Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. I'm energized today. I'm back from the ASHP Midyear Meeting, which was a virtual meeting this year. I hope you had a chance to participate. ASHP was very generous this year. They lowered the tuition tremendously for attending the conference. And actually, if you're a member and you're a fellow resident, technician, or student, the conference was free. So hope you took advantage of that. It was really worthwhile. As I mentioned in the previous episode, there was 13 hours, or 13 sessions, I should say, of pharmacy informatics programming, which is great. I wanted to just give a quick review of my experience with the ASHP Midyear, and I wanted to start with two presentations. There weren't actually pharmacy informatics presentations, but it was the opening session and then the Wednesday wisdom session. So the opening session was featuring Tom Hanks, the actor Tom Hanks. And he spoke about his experience being a COVID-19 patient and what he and his wife, Rita Wilson, went through. And it was very interesting to see what their experience was. And he's back in Australia now after recovering and coming back home and then going back again to do another film there. So the interview actually is from Australia. He looks healthy and happy. And he had a message that was not really about pharmacy or pharmacy informatics. And I'll hold off on telling you what that was. Before I tell you, I want to talk about Dr. Anthony Fauci, who you should all know about, and he's been in the news a lot. And we had the privilege of having him speak on Wednesday morning. And he talked about the pandemic and actually past viruses and diseases that he's had to deal with, including AIDS, HIV, which he was there through the whole process of discovery and developing therapeutics and the whole exposure to the population. So he was right in the front lines of that. And now with the COVID-19 pandemic, obviously, he's been in the front lines with that too. So very interesting perspective on some of these infectious diseases that we've experienced worldwide. But he also had a message. You know, when he was a child, his father had a pharmacy, Fauci Pharmacy in New York, and he used to deliver medications on his bicycle to people's homes. So he has a good appreciation of pharmacy and the profession of pharmacy, and was very positive and upbeat about the role of the pharmacist, especially with the pandemic and administering vaccines. And his message also about life was really similar to what Tom Hanks was expressing. And what they both talked about was doing what you love, doing what you have passion for, being very sure about what you want to do, and then following your dreams. And they both did that. And Tom Hanks mentioned as a child when he realized that he could make a living telling stories, basically, and acting, he thought he had won the lottery because that was like a dream come true, something that he loved to do and that he could do as a profession. So I feel the same way about pharmacy. I love pharmacy. When I was accepted to pharmacy school at age 19 and started when I just turned 20 years old, I was so excited to go through the program and learn about the profession of pharmacy and become a pharmacist. And then later in my career, when I left my job and went to do a fellowship and specialized in pharmacy informatics, back in the 1980s, I again just had this renewed excitement for the profession. And I just love what I'm doing through working through informatics and now being a professor of pharmacy informatics in pharmacy school. It's just been a dream come true. And my message to you all is follow your dreams, know what your passion is, and go for it. Whether it's pharmacy informatics or some other subspecialty of pharmacy, or maybe you might realize it's something totally different. But make the best of your career and do what you love to do. And that was the message that I got from the opening session and with Tom Hanks and also from Dr. Fauci. Moving on to the pharmacy informatics programming, I, as a pharmacy informaticist who's been doing this for a few decades, I didn't really have the wow factor of seeing anything groundbreaking or seriously new, but I did get reaffirmation that what I'm teaching in terms of the basics of pharmacy informatics in pharmacy school is valid, and it was basically validated by the speakers who spoke mainly on topics of data analytics, digital or personal health, and medication safety were really the major topics throughout the 13 sessions. When they got into each topic, I was really impressed with how thorough they were, going into great detail about their specific topic and covering all of the important points. So the lectures were really worthwhile, especially for somebody who's trying to learn about pharmacy informatics or just breaking into pharmacy informatics as a specialty area of practice. I think that this conference was really worthwhile. If there's any way that you didn't attend that you could join and maybe get access to that programming, I think it would be very helpful for you in terms of helping with your career in pharmacy informatics, or at least getting an understanding of the specialty practice. So I did get some validation. I also learned maybe some techniques and some points that I could use to really work on my lectures and update them and improve them for future classes. So it was really worthwhile for me. An example was of the amount of detail that they had was when they were talking about medication safety, and they were focusing specifically on med safety with automated dispensing cabinets, and then went into a lot of detail about workarounds. So people will do at-risk behavior. They will find workarounds to get the job done that really isn't best practice and the safest way to take medications out of the automated dispensing cabinet and administer them to the patient. And so going through all of those different scenarios of where workarounds can occur and how we can improve and educate nurses on not doing those behaviors and maybe putting in our policies and procedures, steps to take to not have to do those workarounds. I think that was really good. And just one example of how much detail they went into and how thorough they were with the topics. So it was a great conference, and I think, again, very worthwhile for pharmacy informatics specialists and those trying to get into the area of pharmacy informatics as a specialty area of practice. I would say that keep it on your radar for the future. So for future meetings, and not necessarily focused on pharmacy informatics, but ASHP has 2 meetings a year. They have the mid-year, and then they have their annual meeting, which is usually in June. And they usually have pharmacy informatics programming in both of those conferences. So keep your eye out for that. As I've mentioned in the past, HIMSS is another organization that has very thorough conferences that include topics that are relevant to medicine, nursing, and pharmacy and other practice areas within healthcare informatics. But that's definitely another organization that's good to be a part of, and to keep an eye out for their conferences and get involved with those, because that's another good way to get up to date and stay up to date on pharmacy informatics topics. So again, if you weren't able to attend the conference, I would recommend seeing if you can join ASHP and maybe get access to that programming. If not, then in the future, make sure and look out for these conferences and sign up. I think you'll get a lot out of it. So just wanted to give you a quick update on my experience at the ASHP Midyear, and I hope that was helpful. So if it was, go ahead and like this video and subscribe to my channel. And in the meantime, stay safe, stay healthy, look after the health of others. And with my new energy that I got from the mid-year meeting, I'll go ahead and work for you, putting together some new episodes for the Pharmacy Informatics Professor channel. Thank you so much for listening, and hope to see you next time. Take care.